Okay. Then check your knee. How about this? Okay. What about this? How about when you step down?
I have to walk sideways.
Sideways.
I cannot walk straight.
Okay. How about climbing?
Same.
Same. So
Going up and down.
your pain mainly in anterior or medial side? How about this? Here or here?
Sometimes here, sometimes here.
Yeah. Okay. Not this area, right?
Sometimes also.
Sometimes also.
Painful.
Okay. Painful. So
It's like there's a knife.
Knife.
The pain is almost like when something cut.
Really.
That's the kind of pain.
That description is typically similar with the neurotic pain, like a nerve symptom, not typical joint symptom, but like herniated disc or something like that.
Nerve problem.
Yeah, nerve problem because it is very sharp and lighting or burning like that. So it's a neurotic symptom. But your knee also has some problem. I will show you the results. So
Is it serious?
yeah, you have serious part or just something. So I will tell you one by one. So you can see the gray one is cartilage. Is covered by the surface of your joint. So thick cartilage is healthy, narrow is arthritis. Yeah? So your medial side somewhat narrow, but remained coverage. Okay, so it is not very severe, but your meniscus is like a shock absorber. So without this, then quickly destruction of the joint. But your meniscus is remained, but partially injured, and it's a degeneration, not the trauma, but degeneration.
Because of aging, doctor.
Aging, yes. So this linkage is somewhat weakened, not strong. This linkage. Okay. We call it root, like root of the tree, and it is linked with the bone and the meniscus, but it was slightly weakened. Okay, so the shock absorption function is decreased, so your medial side arthritis is progressing now, but not severe now. But this is just a grade 2 or only 3 arthritis here.
Osteoarthritis.
Because of the meniscus degenerative tear, not severe tear, but you have problem here. But you don't require any surgery like that. Right? Yeah.
Doctor, if I will lose my weight, it will not.
It will helpful. Yeah, it will helpful, and the speed will slow down.
Okay.
But the more severe part is here, patella bone. This also have cartilage. Without this, that kneeling and using stair is difficult.
Actually, doctor, it's hard for me to kneel.
Yeah.
I cannot do that. But in my mom case, she can kneel. But she don't have cartilage anymore.
Yeah.
So I wonder why. I cannot kneel. It's so painful.
Yeah,
But
every patient is
different.
different. Yeah, it's not uncommon. It's very common symptom. So as you see here, there is cartilage, but there's no cartilage here. No cartilage.
that's my left knee, right?
Right, your left knee here. So there is no cartilage. Okay, so you can see some whitening is like a bruise on the bone, because there's no gray cartilage here. It's
Doctor, I'm sorry. You said because of age.
it's
Aging.
aging. And aging is always one of cause, but not the perfect cause, because your weight, lifestyle, everything is combined with the
Okay.
cause.
Because I can see some Korean, very old people, but they don't have pain. Korean, hanggok sa ramdam.
Yeah.
Naimanayinande. Kurang not painful.
Yeah. Of course.
So I'm thinking, maybe.
So every disease have several causes.
Okay.
Aging is just one of them,
Okay, doctor.
not the only one cause.
Okay,
So
I understand now.
yeah. So here you can see the cartilage here. Okay,
Yes, doctor.
it looks nearly normal, but here no cartilage. Okay, so that is here. Okay, here. So
That's why it's painful.
yeah, painful for the anterior side. Typically when you climb up or down the
Yes,
stairs.
doctor.
Okay, but
So, doctor, in this case, walking is not good for me.
walking is good for you
Uh-huh.
to some degree, not long
Not
distance.
much.
Yeah. When you feel pain around the knee joint, then it's time to stop. Okay.
So, doctor, what's the cause of my hardened part here? Whenever I walk, it became so hard. So, I cannot walk longer. And even here, I need to stop because suddenly it's become hardened and I cannot move anymore.
So, so based on all the result of the study, and the first one you have to do is lose weight and strengthen your back and every part of your body. Exercise, because you don't need any surgery at this point.
Okay.
But your symptoms very severe, and lose weight and strengthening exercise is
Helpful.
universal treatment for your symptoms. So that is current our option, but also you don't have any option because you don't want injection,
Yes,
right?
doctor.
So the
I had
answer
that
is
a lot
that,
of times.
the answer is clear at this point because we have not much options. So I help you need to exercise and weight control. Okay. Weight control.
Doctor, in my age, is this common?
Yeah, even earlier age, FSC medication.
Okay.
Yes.
But stem cell is not recommended for me, right? Stem cell is not recommended yet.
Samsung?
Stem cells
Stem cell.
not recommended in my case.
Stem cell is helpful for you at this point, I think. But my major concern is your neurotic symptom, like hardening and burning sense, some symptom. It is not related with the arthritis.
It's nerve related.
Maybe in the nerve region, because it is not typical for the.
Do I need to
arthritis
take
patient.
medicine with that?
Yeah, I can prescribe you some medication for that. So let's try with medication and lose weight and exercise program first.
Okay, doctor, thank you so
And for your knee joint, some lubricant injection, lubricant hyaluronic acid or the collagen, like that, will make smooth for your knee joints, and it will helpful for the symptom relief. Huh? And
How often do I need that one, the lubricant injection?
injection every 6 months for one injection, one type of injection for six among six, one set. One set is consists of 3 injection every week. Yeah. So but
Doctor,
you,
I'm sorry, is that covered by insurance?
Yes, insurance. You already got injection in knee joint, right? In the other hospital.
It is being shown there. 하긴 하면은 나와요.
나오진 않아요.
Okay.
You told me that
yes, several
already.
times.
Yeah, so that's why you don't want injection.
But this is not the same, right? This is for lubricant.
Lubricant, maybe same with the other.
Is that the gel kind?
Huh?
Gel?
Gel?
Is this one is the gel kind?
Gel kind? No. Gel kind, no. I don't know what gel kind is.
There is something that can be injected, so it will not be painful. It's kind of gel, made of gel.
Well, I don't know. We cannot know the exact regimen of the previous hospital. But
So, doctor, that injection is also painful, right?
injection, when you inject, you have some pain. Yeah. But not severe. Many patients. Today I got maybe 10 patients with the injection. It's a very common procedure in our clinic.
Does it has a big side effect?
Not really. If other infection, but it is very safe.
Okay.
Sometimes some patients have allergy reaction, but it's very rare.
Okay, doctor. Thank you so much.
So you have moderate osteoarthritis of your knee joint, typical, especially in the anterior side here. But currently, the surgery is not helpful at this point. So we have to do non-operative treatment for a long time, maybe several years. Okay.
Okay. My niece is on the 3rd stage, right? Early 3rd stage.
Yeah.
If
Stage
it reach stage 4, need the surgery, right?
But you can see the severe in the anterior knee, but surgery is mainly for the lower part here.
Yes.
But you have a problem in the here. Okay, but surgery is typically for the inside. So if this area go to grade 4, but you don't need surgery at this point.
Okay, doctor. Thank you so much.
Because weight bearing portion, you can walk, right? So there is another point of replacing surgery. So, yeah.
Doctor, I'm sorry. In your case, your knees are okay, right?
Next,
That's good for you.
I'm still young.
I know, but you are very busy doing a lot of work.
I'm still young.
Yes, you look young.
Okay. So it's a very good news that you don't need surgery right now. But repeat again, I had concern because why you have that kind of very typical symptom and very hard time with that. So maybe for the nerve symptom, neurotic pain, but the lumbar spine MRI reveals not very severe lesion, although there is some degenerative change, but it's not typical for your symptoms. So that's my concern. So at this point, just to start with the medication and exercise and so on. Yeah, without any injections first. Okay, or you can choose just one trial of lubricant injection. It is very common treatment.
Lubricant injection.
Yeah, you can start. How about steroid injection? Did you got steroid?
Doctor, I don't want that because it will be. I will become more bigger.
Because of the steroid?
Yes.
Have you ever experienced?
Actually, doctor, I don't know because I just know it's an injection, but I don't know to classify if it has steroid or doesn't have. So, doctor, this kind of injection, the lubricant, will make the symptom shorten. It will prevent.
Number one, because it's a symptom relief, but preservation time is very different from among patients. There is just the similar regimen with your natural knee, just a lubricant. It's generally very safe, but the power, not that powerful, but some degree relieve the symptom. Okay. So if you don't have any experience, then you can you may try that injection.
Okay.
It's not steroid. What do you want?
The injection will be performed this time. Are you going to perform this time the injection?
Oh, yeah. So it can be done today or 1 week later. It's no problem.
1 week later.
It's better.
Yes, right.
Yeah. Then let's try to medication first. Okay.
Doctor, I'm sorry to ask you. Is this helpful for my mom? This kind of injection?
Yeah. Many Korean patients get injection regularly because before the surgery period, because it will helpful for the symptom relief to some degree.
Okay. So in the case of my mom, how many times does she need this one? Once a week?
Once a week, 3 times, typically.
Yeah. In a week, 3 times?
Yeah, every week. One shot every week.
Okay, 1 shot every week.
Okay. And the X-ray will be cost for your mother about 40,000 won. 40,000 won.
Oh, not bad.
Okay.
Doctor, I'm sorry. What about this injection for my mom? How much it will cost?
1 shot for several 만원인데. $30,000 won.
Okay, not
for
bad.
one
Doctor.
knee and double for the fourth knee.
Doctor, is it possible for my mom to have the X-ray today?
Yeah.
And the injection as well?
Immediately is okay.
Okay, thank you so much.
Okay, then today I will prescribe you for 1 week and see you 1 week later. Okay,
Okay, doctor.
그러면은
So I need to register my mom there at the
yeah,
counter.
yeah. Okay. Okay.
Yes, doctor.
Yeah.
Thank you so much
See you
for
later
everything.
with your mom.
Yes, enjoy your lunch.
Thank you.
Yeah, go.